How's everybody doing? And welcome to SSN, or as we affectionately refer to this channel around here as the Sergeant Saunders Network. I'm back after a long hiatus. Steve Dallas here. I will be your host as we venture forward with the Sergeant Saunders Hour. Now, without further ado, hop in, buckle up, and let's get ready to roll. How's everybody doing? This is Steve Dallas. I'm coming at you live. No, not yet. This is just a video. Soon we're going to go live once we build up the following again. But basically, we got a good video for you. This is from day 20, which was yesterday. Basically, it's Depp versus Heard, and this is day 20, part 1A. What I did was I broke down the two witnesses into cross and then in direct, and then cross, and then the redirect. So we're going to do this set of slides first, which is going to be, oh, I hit the wrong button. I'm trying to reverse this. There we go. I wanted to add the slides to the screen, make me smaller. So basically, the players, we know the players. The players are Amber and Johnny. That hasn't changed. But yesterday, the way they were dressed, Johnny looked pretty good, right? And Amber, I don't know what the heck she was wearing. I'm not going to make fun of her, but whatever. She wears some strange things. I don't know who's dressing her for court. And then basically, the first witness of the day yesterday was an expert orthopedic doctor. His name was Dr. Richard Moore. And he's a witness for Heard's. Our team called him. And basically,
Your Honor, Amber calls Dr. Richard Moore.
All right, Dr. Moore.
So he came up to the stand. And basically, the lawyers in this two-parter, we got on direct was Rottenborn. He's Amber's lawyer. And then on cross is going to be Camille Vasquez, which is Johnny's lawyer. So you're going to hear her object. You're going to hear Rottenborn talk. You're going to see him in the video. And basically, I have, like I said, I have it broken up, so there's going to make the videos a little shorter. So we're going to do it direct now, and then we'll do the cross. Will be part 1B. And before we do that, though, right out of the gate,
And let's talk about that anatomy. There's bones in the hand, right?
Correct.
And then there's tissue and blood vessels, right?
Objection, bleeding.
Overruled.
right? So there she is. So she's off to a good start. And you're going to see, we'll see her tone throughout the direct. She objects and stuff. We'll see what's going on. But before we go into the video, I just want to warn everybody, there are some graphic pictures of what happened to Johnny's hand about halfway through. So you may find that disgusting. If you find it disgusting, you may want to fast forward. You may not want to watch that. I just want to give you a heads up that will be in here. Basically, on the cross, the direct, and also on the second witness we're going to cover, I've shortened down the videos. I've thrown some stuff in. I've made it entertaining and funny. You may get offended on some of the fun I poke here or there. It is not meant to single out Amber or Johnny. As most of you know, if you've been following me, whether on here or just, over the past 20 days talking to you, I'm kind of for Johnny, and I think he's going to win. But, I poke fun at both of them at points. So before we get going,
there is nothing wrong with your television set. There is nothing wrong with your television set.
Here we go. Just takes a second.
Have you published in your field?
I have.
In peer-reviewed literature?
Yes.
Your Honor, at this time,
So I cut out all
we'd like to
the
offer
credential
Dr.
stuff
Moore
because
as
that
an
took like
expert
15
in the
minutes.
field of orthopedic surgery, and specifically hand surgery and injuries to the hand.
All right, any objection?
No objection, Your Honor.
So moved.
So he's an expert witness. They didn't object. They didn't try to get rid of him or anything. He's in.
Dr. Moore, now we get to talk about this case. At our request, what have you reviewed? Just general categories of information have you reviewed at our request in this case?
So So a tremendous amount of material. I reviewed the video deposition and trial testimony of Mr. Depp regarding the injury, the medical records from Australia, the photographs of the injury from Australia and Los Angeles, texts and emails, the deposition of Dr. Kipper, and I'm sure there's more.
And when you reviewed the deposition of Mr. Depp, was that just in paper form?
It was a video deposition.
And so what did you review of that deposition?
The section where he describes the injury.
And did you see a video of him describing it?
I did.
And you watched the testimony from this trial of him describing it?
Yes.
And you mentioned that you reviewed some texts as well. What are those?
There were communications
And here's a message from our sponsor, Amber Heard.
amongst Mr. Depp and his physician and
See if you
and,
figure out
and
that
others.
reference.
And what did you specifically review in those texts relating to the finger injury?
Well, with relation to the finger, there was a
Like
text
Johnny's
where he had stated he cut his finger off.
I lost my hand! I lost my bride! Johnny has his hand! Johnny has his bride! You want me to take my heartbreak, put it away, and forget?
Now, Dr. Moore, I'm going to ask you some questions about this case regarding the opinions that you formed relating to Mr. Depp's finger injury. When I ask you those questions, do you agree to answer my questions to a reasonable degree of medical probability?
Yes.
And do you agree to advise the jury and the court if you
should
are
fix
not
it tight,
answering
quick.
any of them to a reasonable degree of medical probability?
Yes.
Dr. Moore, based on your analysis, did Mr. Depp's finger injury happen as a result of a vodka bottle being thrown at him?
Objection leading.
Overrule.
I'm sorry.
No.
And what is the basis for that opinion?
Well, the medical data is inconclusive. It's not consistent with what we see in the
Johnny's like, what the-
described injury pattern or in the
Guys making
clinical
crap up.
photographs. And there are several elements. There's the description was of the hand being flat on a bar and the bottle crushing the finger from the top.
Crush orange. They're not our
But
sponsor.
looking at the images, there's really no significant injury to the dorsum of the finger, and to create the type of injury with that type of a crush injury, we would anticipate both injury to the fingernail and other parts of the finger.
Can I stop you there and
Sure.
just break down a few things? You said the hand resting flat on the bar. Can you show the jury what direction the hand was resting based on the documents you've reviewed?
I think that the demonstration was with the hand flat, like this, across and maybe even curled over.
There's the hand.
The edge of the bar like this.
Which side was facing upward? Which side of the hand?
The back of the hand.
But that's
or
not what
the
Johnny said.
dorsal
Johnny
surface
said
of
his
the
hand was hanging
up.
over the bar.
Doctor, if you could get closer to the microphone.
Oh,
I'd just appreciate
sorry.
it. Thank you.
Thank you, Your Honor. So you referred to the back of the hand as the dorsal side of the hand, is that
That's
right?
correct.
Sort of like the dorsal fin on a shark?
Correct.
Fair. And what is the other side of the hand called?
The palmar surface.
Palmar? Okay. So what direction was Mr. Depp's hand resting on the bar?
So the dorsal side was up, which with the descripted mechanism of injury or the injury, the bottle would have struck the top of the finger at the fingernail.
And you also mentioned a term that I'd like you to explain to the jury, crush injury, please.
So with review of the images and the x-rays, I mean, this was a crush injury.
Crushing, you say? A little skeptical.
That would generate the findings clinically on x-ray that we saw. The fracture is a we call it comminuted, and the tip of the finger is in multiple splinters. So there are multiple fragments, and typically you see that with a crush type injury.
So a comminuted fracture is one where there's multiple fragments of bone.
That's correct.
And what was the basis, other than what you've read and heard, but from the pictures, what was the basis of your opinion that the hand was resting palmar side down?
Well, that was the way the injury was described.
Right.
And demonstrated in the videos. And so in that
like they're
position
making
where the
stuff up
bottle
here.
to strike the finger the way it was described, it would have struck on the nail. And the nail was really not injured. And so that's not consistent with that pattern of injury.
Michelle, could I get you to pull up exhibit DX 369, page 26? Your Honor, this is admitted. Ask for permission to publish.
Yes, sir.
Thank you, Your Honor. Dr. Moore, is this one of the images that you reviewed?
Photos.
Yes.
Tell us, in relation to your expert opinion on the cause of Mr. Depp's injury, tell us what you see in this picture, please.
Freddie's here.
So this is it looks like an avulsion type injury where tissue's actually pulled or pinched away. I think what's important in this picture is that the tissue loss is on the palmar aspect from underneath the finger,
It doesn't
rather
look like
than
that finger was crushed to me.
all,
I've seen injuries
transversely in the finger, which you would
That doesn't look
anticipate
like a
if
crushed finger to
the
me.
bottle struck the finger. You would expect more of this level of injury rather than isolated to the palmar aspect.
Palm off, right? That's what I think of him.
And what do you notice about the condition of the fingernail in this picture?
So from this image, the fingernail appears to be intact. You can't necessarily see the entire nail, but there are other images that have a better profile of that. And the nail is not elevated. There's no subungual hematoma beneath it, or there's no bruise underneath it. Anyone that's ever stuck their finger in a drawer or caught it in a car door or hit it with a hammer knows that almost immediately there's typically bleeding underneath the nail, which creates this hematoma.
So, not being a doctor, I'm going to try to summarize what you just said. Are you saying that in an injury like this, if something had come from the top, that there would be an immediate impact to the fingernail bed?
That's correct.
Michelle, could you please
It
pull
looked like
up
to me it was cut from the
Plaintiff's
side,
Exhibit 144,
which is
Your Honor, this
consistent
has
with
been
Johnny
admitted
is
as
saying.
well.
All right. Thank you.
Dr. Moore, I believe you mentioned just a few minutes ago that there were other pictures that showed more of the nail.
Well, it's more like a
Is this one of those
like a
pictures?
clean,
Yes.
clean cut.
And
Not a
explain to the
crush.
jury, again,
Not
I'm
a
sorry
knife.
for the graphic nature of this photo, but it's important that the jury understands the basis for your opinion
What do we know? I'm
that
not an expert,
a
right?
bottle couldn't have caused this coming in from above.
Plunging into a 70-degree dive.
Yeah, so it's again, the mechanism described would have almost certainly led to severe nail injury. You know, I see no subungual hematoma. Again, it's a palmar tissue loss, and the loss is from distal to proximal, which is from the tip back far below the nail. And so for it to create that tissue loss down there would almost certainly have to be injury dorsally with that described mechanism.
So what you're saying is that something coming from the top could not have left the nail intact and yet caused injury from the tip of the finger underneath the nail.
Objection leading.
It goes.
You can answer.
So I believe that with the mechanism described, that if the bottle struck the nail, there would have certainly been an injury to the nail bed, and in order for the soft
Fascinating.
by that mechanism, there would have almost certainly been tissue loss on the top of the finger as well.
Does Mr. Depp's description of what happened line up with the undisputed photographic evidence that you've reviewed?
Oh, yeah, absolutely, 100%.
No.
Now, we mentioned the term crush injury a
Right.
few minutes ago. I'd like to show you DX360, please. And Your Honor, this is, we won't publish this at this time. Is this a document that you reviewed in connection with your expert opinion in this case?
Yes.
And Michelle, if you can please go to pages, I believe they're 5 and 6. Your Honor, I'd ask for permission to publish these as a demonstrative to the jury.
Just page 5 and 6.
Sorry, 09 and 10.
Page
2
09
pages.
and 10. Could you go to 10 also so plaintiff can see it? Okay, any objection to 09?
No objection, Your Honor.
Okay, 09 or 10 can be published.
Dr. Moore, what are these
Oh boy. Look at that break.
pictures of?
So these are x-rays of the injured digit.
And what do you observe in these x-rays? Explain to the jury what you see.
So these are two views. So one in the plane looking through the finger in this direction, one in the plane looking through the finger sideways. And you can see that the tuft or the tip of the finger, the last bone in the finger called the distal phalanx, is
Ooh, Spartans.
shattered. You can see there's multiple little spicules of bone. And there's also a transverse fracture at that level, which runs through the bone. So this is what we would describe as a comminuted fracture, and it's commonly associated with crush injury.
This is Sparta!
In your decades of practice, Dr. Moore, have you ever seen a
Russian.
comminuted fracture like this result from an object thrown in the way that Mr. Depp described?
Well, not with the constellation of findings shown on the X-rays. I mean, I think that could create a fracture, but in this setting, it wouldn't create a fracture with without the associated other injuries that we would anticipate.
And in your decades of practice, when you see a comminuted fracture like this, what are some things that have typically caused it?
So crush mechanisms could be slammed in a drawer, caught between two logs in the fireplace, car door, sliding glass door. Those are all any mechanism that squeezes the finger between two hard opposing surfaces.
Oh boy.
Could create this type of injury.
In the statements of Mr. Depp that you reviewed, how did he describe what happened to the alleged bottle when it hit the bar?
I believe he said it exploded, shattered.
If a bottle had exploded near his finger in the way that he alleges, what would you expect to see in the documents that you have reviewed?
Well, I think that the physicians did a good job of documenting the presentation, the appearance of the wound. They did not document the presence of any glass shards, and there were no other associated injuries elsewhere on the hand.
And I just want to step back for 1 minute. Michelle, can you pull up the next page of the x-ray here? Thank you. And Dr. Moore, just before we move on from x-rays, can you, I know that this, when it's blown up like this, it's a little bit blurry, but can you point out or describe to the jury where the multiple bone fragments are in the finger?
So they're in the very tip. If you see the joint, and then there's what we call the transverse fracture, which is across the middle of the bone in the same plane as the joint, and then the multiple fragments are in the tuft. With a Xerox copy, the quality is not as detailed as a true X-ray.
You can take that down, please, Michelle. Thank you. So back to the glass. In the records that you reviewed, Dr. Moore, did you see any adjacent injuries? In other words, injuries to any other part of Mr. Depp's hand other than the tip of his middle finger?
No.
And is that observation consistent with the explosion of glass type phenomenon that Mr. Depp alleges?
Well, I think in the setting of a glass explosion like that, where there's multiple fragments and the tip of the fingers cut off, you would anticipate that there would be other lacerations.
Did you review the documentation in the medical records from the hospital in Australia?
Yes.
Did any of those providers report retrieving glass from the wound?
No.
What about any glass near the site of the injury?
No.
What about any glass in other parts of the hand?
No.
What about any glass in any of the other fingers?
No.
Is there any reference at all, Dr. Moore, that you've seen to any glass in the records that you've reviewed?
No.
And Dr. Moore, in your decades of practice, have you ever seen an injury associated with a glass explosion that was focused on the end of a single finger in the way Mr. Depp describes?
Well, not consistent with the clinical images and the findings in this case, no.
Have you ever seen an injury associated with an alleged glass explosion where no other glass was found on any part of the patient's body or clothing or anything?
No.
And because there's been talk of a glass explosion, Dr. Moore, there's seems to have been a suggestion that somehow glass may have sliced off the end of Mr. Depp's finger. Is that what's going on here?
No, this wound doesn't really appear to be a sharp glass laceration.
You referred earlier to an avulsion, which is a term I had never heard before. Your opinion in this case. Explain to the jury what that is, please.
So often with crush injuries and we'll see tissue loss that we call an avulsion, or where the tissue's actually pinched or pulled away.
Oh boy, tenderized, pulverized.
Rather than sliced or cut. It's not uncommon with crush injuries to see that.
In your decades of practice, Dr. Moore, have you ever seen an avulsion injury with a partial amputation that results from an object thrown from the top of the finger in the way that Mr. Depp describes?
Oh boy. So if he cut it off like that, it wouldn't
No,
look like what
again,
he
I think
described.
that the description differs from the clinical appearance on the images.
Michelle, can you please pull up Exhibit 369 at page 12? This has been admitted, Your Honor.
All right. We publish to the jury.
Dr. Moore, you said you've treated thousands of hand injuries over the course of your career, correct?
Correct.
Yeah, I survived it. There was a massive 2.2 metre croc.
What is that on Mr. Depp's hand?
So we describe that as a
Objection calls for speculation.
He was in Australia.
just
Maybe it was a
changed.
crocodile.
Sorry, page 12, please.
Homer!
Okay. Thank you.
Thank you. What is that on Mr. Depp's hand?
So that's a plaster
I'm sorry.
splint.
Overruled the objection.
Okay, sorry, thank you. I'm sorry, please tell the jury what that is on Mr. Depp's hand.
So that's a plaster splint. A half a cast is how I sometimes describe it to patients, and it provides stability for comfort and to protect fractures in the course of treatment.
Is that plaster splint hard or soft?
What's plaster Paris? It hardens like a cast does.
Dr. Moore, does Mr. Depp's description of how his finger became injured line up with the facts that you've seen?
No.
I have no further questions.
All right,
Thank you, Dr. Moore.
Cross-examination.
Okay.
Allow them to perform the surgery in cadavers.
We remove that there. And basically, I'm just going to throw this up there. So, if you've been following the trial, and what I did here is I tried to make it funny and entertaining because a lot of this stuff is very boring. And I did cut out the beginning stuff with all his credentials. So it's going to be shorter than if you watched it on another channel. But this is the highlight of his testimony. What I noticed about Dr. Moore and what we have to figure out, we could say things that we think, like, obviously we're going to see on cross in a few minutes what's going to happen when Camille gets him. But for the most part, I look at it like this. Was he likable? Was he credible and was he believable? Because if he was sitting there on the jury, right, these are things you're going to be thinking about. And out of all her witnesses that she's called, um, he's the most normal, right? All the other ones have had something or been a little weird, or the video testimonies have been boring. He came in and he's credible because he's a surgeon. He's likable, right? If the way he was talking, right? And could he be believable? Well, yeah, maybe, but we already have factors that we know. So I think most of the jury at this point is already kind of. I don't think they're on the fence about this. I think they don't think that he cut off his finger by himself. So I think what they're trying to portray is a lie. And how do you do that? You got to bring in experts to refute what the other side says, right? So you know, could he believe what he says? He's been a doctor a long time. I find it hard to believe. He did say though it wasn't from a knife. He thinks it was crushed between, something like doors or something. So, for him to be believable, right, you have to be persuasive. We must be believable to be believable. We must be credible. To be credible, we must be truthful. So, will that all stand up under the scrutiny of a juror sitting there? Are they going to think that he's giving a truthful testimony? Now, we haven't seen the cross yet. We're going to see that in a few minutes. Like I said, I broke it down to make these videos quicker so you can get to them and get up to date. So in a few minutes, we're going to see what happens on cross. And
there's only one thing left to say. Ladies and gentlemen, let's get ready to rumble!
go. Camille's going to be taking the center stage in a few minutes. If you like the video, please subscribe and hit the like button. And more videos to come. It's not only going to be about this. I just happened to jump into this because it was a personal thing I was following and I was telling people about. Again, more the people I hang out with are older than some of the younger ones watching the trial. And again, just because you may be Republican or conservative does not mean that you're against Johnny. Most of us, and I showed even in that first video, I threw a little thing in there. The things that he said against Trump, I don't hold that against him because I think, under the situation, we've all said something stupid. We've all done something stupid. But now knowing his history of what was going on at that time, he was under the influence. So, he did what he did. Plus, he was hanging around with Perry, in his group, and Perry does not like Trump. He does not like Republicans. So he was probably influenced by the people that are around him. And again, the only reason why I brought that up is because I think there's no place for that no matter what side you're on, because in today's modern society, people, he has the center of attention, and he is, whether you want to like it or not, I don't want to say role model, but people do look up to him. And especially you could see, the people outside, how they react to him. People follow him, and not only himself, but anybody that's in that public eye or in the fame. I don't think anybody should say anything about any president or just anybody in general that would, have the potential to create a violent situation, because we do know there are people in society that sometimes act upon those things. So anyway, I hope you enjoyed the video. The other one will be up there shortly. I'm actually going to have 3 more up there because then there was also another witness from yesterday. And then tomorrow I'll probably have today's videos up. But thank you very much for tuning in, and I'll speak to you all soon.